All right, thanks, Ryan. Stroke is a potentially deadly event that afflicts millions, thousands of people, that is. Here to talk about the signs, symptoms, and treatments is Dr. Kelly Matmati, Stroke Program Director and Chair of Neurology at St. Vincent's Medical Center. Doctor, welcome.
Thank you.
So what happens to the brain when someone has a stroke?
So a stroke happens when the interruption, when there's an interruption of blood supply to part of the brain, causing neurological symptoms. And the most common reason for this is if there is a blood clot blocking one of the arteries of the brain. And this causes the brain cells in that part of the brain to be starved of oxygen and can cause damage. Another type of stroke occurs when an artery in the brain ruptures and can cause bleeding into the brain, and that's called a hemorrhagic stroke.
And which one is the most common?
The most common is an ischemic stroke that's caused by a blood clot blocking an artery.
Okay. And let's talk about some of the signs of a stroke.
So there's an acronym that we use to try to remember some of the common signs of stroke, and that's B FAST. B stands for balance, if there's a sudden loss of balance. E stands for eyes, and that can be sudden vision loss on one side or a problem with moving your eyes. The F stands for face, which means a drooping of the face on one side. A stands for arm, which means that sudden weakness in one arm and inability to lift it. And the A stands for speech. It's slurred speech or difficulty speaking. And T stands for time, which means if you have these symptoms, it's time to call 911.
I know I had a friend who had COVID early on in the pandemic, and he recognized the signs and got help. All right, what is a thrombectomy?
So a certain type of stroke called a large vessel occlusion stroke can cause blockage to blood flow to a large part of the brain. And that type of stroke can be treated with a procedure called an endovascular thrombectomy. In this case, the surgeon puts a catheter in through an artery in your leg and winds the catheter all the way up into the brain and uses that catheter to pull or suck out the blood clot that's causing the stroke. And by doing so, the stroke can be cut short and actually give the person a better chance of making a full or meaningful recovery.
All right, tell us about what services are offered at the stroke clinic.
So we have a stroke clinic at St. Vincent's that offers follow-up appointments to all of our patients who are discharged with stroke. And we try to do that very early after discharge. Following up with your neurologist very shortly after discharge from a stroke has been shown to reduce the risk of you actually having to be readmitted to the hospital for another stroke or other complications. So we review all of the medications that you're taking for stroke prevention and make sure you're on the optimal treatment regimen to prevent another stroke. We also do a lot of stroke education, which is also very important in helping prevent another stroke.
All right, Dr. Kelly Matmati with Hartford Healthcare St. Vincent's Medical Center, thank you for the great information.
Thank you.